If you are feeling pain or discomfort when you move, you can count on the experienced team at Mercy Health to help. We met with Dr. Evan Smith, a knee replacement specialist at Mercy Health, to get a better understanding of what's involved with surgery.
When we think about the knee and we think about arthritis that develops in the knee, there's really kind of three main areas that arthritis develops. If you have arthritis in multiple areas, the full knee replacement is a good option for you because really it resurfaces the whole knee, gets rid of all of the arthritis in the knee. If you just have arthritis in one part of the knee, something like a partial knee replacement is a good option where we're just resurfacing one part of the knee. There's some really key benefits to the partial knee replacement. Now, not everyone's a candidate because a lot of people will get arthritis throughout the knee. But for people that just have arthritis in one part of the knee, the partial knee replacement allows sort of a quicker return to normal activities, lower pain. People say it's a more normal feeling knee, which makes sense because we're taking out less of the ligaments and tendons in the knee. So like I said, not everyone's a candidate, but if you are a candidate, it's a really good option. So even the day of surgery, we get you up, we have you moving around, we have you putting a little weight on the leg, making sure you're comfortable, and then we have you start, doing some gentle bending. The reality is the first couple weeks are just about healing the knee. Then after a couple weeks, if you're feeling good, we start that protocol of bending the knee, getting the range of motion back, and then eventually building up strength. I see every patient at 2 weeks and 6 weeks. And usually by that 6-week point, we have a good sense of sort of how you're coming along and what your comfort level is at getting back to some of those activities that you were doing before. The reality is the reason we do the knee replacement is really to allow people to get back to a quality of life that they want. And we're seeing more and more people that are higher demand, so to speak. So people that want to be running, biking, jogging, hiking, all those things. So really outside of a couple activities, things like tackle football, rugby, outside of activities like that, we really let people get back to doing what they want to do. So really long-term, no limitations as far as activities you can do. Sometimes we see some sort of, anytime we do surgery in the front of the knee, you may get some tenderness in the front of the knee, particularly putting weight down on the knee. At the end of the day, it's still a metal and plastic knee, so you may get some clicking or knocking in the knee. As long as it doesn't cause pain, then we're not too concerned about that. So there are multiple companies that make the implants. They're pretty standardized at this point as far as what the materials are. They're made of titanium as well as cobalt chromium. And then so really kind of high durability metals that we've been able to test both in the lab and then in real life over the last 20-30 years. And we see that they're really durable. Knees that were put in 20 years ago, and those were knees that were put in 20 years ago, 80% of them are still in. So they're functioning really well. And then between the metal is actually a piece of plastic. And it's a very hardy piece of plastic. And likewise, the knees that were put in 20 years ago, they're seeing very minimal wear. So the metals and the plastics are very high quality. They last a really long time. Anytime we do surgery, and this is any orthopedic surgeon you speak with, there's always a risk of infection. So that's always, what keeps us up at night is trying to limit and mitigate those risks. When we look at, large studies that are done on knee replacements, the risk of infection is less than 2%. So as long as we do our job well, the risk is very small, but it's always there. Otherwise, part of the process of getting you to surgery is having you see your primary care. Make sure your labs look good, make sure your heart and lungs look good. So when we get you, there's no surprises and those risks are very small. Surgery takes about an hour, hour and a half. Somewhat can be dependent on how much arthritis you have in there, but that's kind of what we're finding. When we're dealing with arthritis, unfortunately at this point, we don't have the technology to reverse arthritis. And I see people in sort of different parts of that sort of the process. Of some people that, the arthritis is kind of stable, and then I see some people who it's gotten progressively worse. The things we do for arthritis are anti-inflammatories. Physical therapy can be helpful to build up strength around the knee, to take stress off of the bones from rubbing on each other. Things like injections can be helpful, like cortisone or some gel injections can be helpful. But unfortunately, once we've kind of exhausted those things, really we get into the discussion about resurfacing the knee, and that includes, like I mentioned before, the knee replacement, the partial knee replacement. And we find that those are the most durable options as far as providing relief. There are some more experimental things out there, but unfortunately the data just isn't super consistent with providing consistent relief with those. When we think about complications afterwards, really the risk in general, just speaking kind of globally, the risk of complications is quite low. It's a surgery that, you have people like myself that essentially this is all we're doing. So we've been really able to perfect the process as well as the surgery, so the risk of complications are quite low. We're talking less than 3%. So that's reassuring for myself, is knowing that I can do a surgery on people in their 70s, 80s, even 90s, and know that the complication risks are very low. They always exist anytime you do surgery, regardless of what it is. But we know now we can do a good job and keep the complication risk very low.